Genyate murimu wa ngoro kana mirimu ya ngoro gatagate ka mbeũ njithi kuma gĩtarũ kĩa Mount Kenya na county ya Nairobi ithiĩte na mbere na kuongerereka o gwakĩa ũhoro ũyũ nĩ kũringana na marigitari a mirimu ino ya ngoro makiuga ũhũthĩri wa njohi ũndũ na ndawa cia kũrebia na mĩrĩre mĩũru nĩcio iracũngĩrĩria mũrimũ ũyũ, kuona mĩrimũ ya cukari na gũteng'era gwa thakame nĩmwe ĩkoragwo ĩgĩtwarithĩrĩria kĩnene kĩa kũrwara mũrimũ wa ngoro. John Kahia wa Francis na riboti ĩno.
Mugaru na miaka ya hau kabere kuria mirimu ya ngoro irarwaragwo ni andu aria mari na makiria miaka 60. Riu mbeũ njithi aria mari thutha wa miaka 40 mari kigera-ini gia kuragwo ni mirimu ino. Ũhoro ũyũ nĩ kũringana na marigitari a kũrigita mũrimũ ũyũ kuma rũhonge rwa bũrũri rwa Kenya Cardiac Society, makiuga gĩtarũ kĩa Mount Kenya na kaunti ya Nairobi nĩkuo thĩna ũyũ wĩhĩrĩirie kumanagia na ũhũthĩri wa ndawa cia kũrebia, njohi na mĩrĩre mĩũru.
What we call the hotspots for cardiovascular diseases, and these are areas where there is high levels of hypertension, diabetes, and lipid disorders, more so the urban areas of the country, and especially from national statistics, we've seen this a lot happening in Nairobi and the peri-Nairobi areas, the central Kenya and the mountain region, and this, of course, has thrown us back to the drawing board to find out what is the reason.
Amongst females, the younger patients tend to have a lower risk of cardiovascular disease compared to those who are postmenopausal.
Back in the days, we used to have cardiovascular diseases more prevalent in maybe people above 60, but now we have them in people as young as 40.
Marigitari makiuria muingi gwitikira guthimo mahinda kwa mahinda kuona murimu ino iratiga family nyingi iri nokia kuona ifataraga mbeca nyingi kurigitwo ndumwe na guthinia thirikari kuona insurance ya ũgima wa mwĩrĩ ya SHA no irahuthika.
The increased spending and costs of treatment. You have to pay for transport to the hospital, you have to pay for the consultation to see the doctor, there's a test to be paid for, there's the drugs to be paid for, all right? And if the patient comes in an acute or emergency setting, then they have to be admitted. That's an additional cost.
Complications, and then there's also, it affects the quality of life. So for example, if you get cardiovascular diseases, or if you get, if one of the complications you get is peripheral artery disease, then you may not be able to walk properly, you may end up being a wheelchair bound.
Marigitari ya kuma thibitari itiganite mwaka waragio hindi ya mathomo ma nduku 3 kuri arutwo aria mathomagira mathomo maya ma mirimu ya ngoro, kuria cardiologist munene wa Othaya Rifaro oritie muingi wa Nyeri na matura maria marigiceirie gwetha motungata maya thibitari-ini ũgũkũ akiuga marigitaga arwaru matanyiheire 40 o muthenya.
But particularly in the central region around the Mount Kenya, we have a very high prevalence of diabetes, which actually is a major risk factor for patients getting heart disease, heart failure, heart attacks. And we also have a high prevalence of hypertension. On average, here we see patients in the medical outpatient clinic, about 30 to 40 patients whom we are following up for either hypertension or for diabetes. We have a separate specialized heart clinic, cardiology clinic, where we see now the patients with the complications arising from those particular.
Kuma Othaya Rifaro, County ya Nyeri, hadu ni GTN TV, Jitego Kahio John wa Francis.